My name is Bill Manson. I'm the Chief Executive Officer at ANMed Health in Anderson, South Carolina. I also have the privilege of serving as the Chairman of the SCHA Board this year. And I particularly want to welcome you to this 8th annual South Carolina Transforming Health Symposium, and particularly today's topic of leading patient safety. We are doing some great work here in South Carolina. I'm very, very proud of the work that we, both as a state and as healthcare providers, are doing in terms of high reliability. We'll talk a little bit more about that. On behalf of the sponsors for today's program, let me name them. First of all, Blue Cross Blue Shield of South Carolina, Health Sciences South Carolina, PHT Services Limited, Mothers Against Medical Errors, and the South Carolina Hospital Association. I want to thank each of you for being here today, and also thank the staff from each of those sponsoring organizations for all of their hard work in planning today's symposium. Let's start off with a quote and see if anyone in the audience knows where this quote came from. "We are what we repeatedly do. Excellence, then, is not an act, but a habit." Anybody name the author of that quote? Aristotle. We've got some good students in the room. But think about how relevant that quote is to the work that we need to be doing as healthcare providers today. That is making our actions as healthcare providers highly reliable and a habit, something that we do regularly. It's a philosophy that we can still learn from after thousands of years. Today, our discussions will be sparked by ideas of some modern day experts and philosophers. We're going to talk about how bold leadership can drive positive change. We're going to talk about empowering patients to become our partners, not only just in health care, but in their health as well. We're going to talk about how we can build a strong structure, a steel backbone that supports a highly reliable healthcare system, and how we can do that collaboratively working together. This symposium provides such a welcome opportunity for each of us to view our current roles in a very different light, and maybe with fresh eyes, so that we might learn from our national colleagues and from one another about new and different ways to accomplish what we have in front of us. Today, we're going to celebrate our many successes and honor the innovators who have made a significant difference for patients in our state, and renew our collective commitment to providing dependably safe, consistently high-quality care to every patient, every time. Today, I hope each of us will take the opportunity to seek out creative ideas and conversations, even during breaks, about what others are doing around us and what we might take away, so that we might be able to shape the future for South Carolina hospitals and for the citizens of our great state. We had a breakfast this morning with some of the sponsors and some of the invited guest speakers for today to talk about some of the really innovative things that are going on across the country. And so I'm very excited about what you're about to hear about through this program. And I, again, want to thank all the sponsoring organizations for helping put this great program together. It's my pleasure to introduce, to start the program for this morning, the new Vice President of Quality and Safety at SCHA, Lori Gibbons. Lori is taking over that role with SCHA. She's filling some big shoes in terms of Rick's work with SCHA over the years, but Lori is well prepared to help lead the South Carolina Hospital Association and our activities as we try to further advance the work that's being done in South Carolina. So I want to introduce and welcome Lori Gibbons. Lori?